Help them see the problem, suggest solutions, but help them, suggest them, but don't do it for them. Remember, you can't sail their ship. They're the only one that can. And then a self-motivated culture of excellence. You said in the past, John, that you were able to have pretty good blood sugars for 2 days last week. How did you get there, and how could you repeat that to do that again? It just kind of engages that patient in their successes. And then standardize and repeat key behaviors. Motivational interviewing. It works with, not at the patient, and I'm telling you what, that is a paradigm shift for the medical field. We are so used to fixing and directing the patient. It is a whole paradigm shift, and it takes practice. When we first started our class, it was like we debriefed after our first class, and it was like, I kept correcting, or I kept saying, oh, you need to do this, or you need to do that. And now our classes, we have become so used to motivational interviewing, facilitative style. We open up, ask the questions, and that's about all we do. It has wide application. You can change health risk behaviors, health promotion, self-management, and success. We start our classes out every time when the patients come. They weigh themselves, they do their own blood pressures, and then they do a blood sugar. And then we talk about those blood sugars, talk about what they had for lunch, because we want to make sure they're doing it right. It was interesting because we send our patients home with home monitoring blood pressure cuffs. You would not believe how many don't do it right. And we send our patients home with all these things to use, but they don't even know how to use them correctly. So resist the writing reflex. Remember, you don't want to be working harder than the patient. And often as nurses and medical professionals, we do try to work harder than the patient. Understand their motivation. Where are they on the confidence and readiness scale? And I'll talk about that in just a minute, because that is one of the key focuses of the class. Listen with empathy. It is hard to live with diabetes. Is it impossible? No, but it is hard. It's a change in life. New diabetics, when they come, they are so overwhelmed because all they've heard is how they're going to have to change everything. You have to take it in increments. First of all, they don't remember one thing they heard after their first meeting, and it's a very slow process. And then, while really empowering the patient and building their confidence. One of our patients came into the class with a 15.6 A1C. He was a pretty sick fella. He was pretty motivated at the beginning of the class because he'd been in a diabetic coma and been hospitalized. But it's so amazing to watch the change in this patient. His A1C is down. We've incredibly cut his insulin down. On his own through this class, he no longer drinks regular soda. He's exercising 2 30-minute segments a day, and he's reading labels. And he is not still taking the big granola bar on the hike. But it's exciting to see these changes take place. So what is the confidence and the readiness scale? They're great dialogue tools. We often say to the patient, or we do say to the patients, on a scale of 1 to 10, how confident are you that you can better control your diabetes? I've never had anyone say a 0. They usually say 3-ish. And you'll say, why a 3 and not a 0? And then you start that dialogue, because then it shows that they do have some confidence. We also ask on the readiness scale from 0 to 10, where are you on the readiness scale? And you will see at the end when I show you one of our slides the changes from our pre-class survey and our post. It's phenomenal. But they often will say 2 to 3, and then that starts a dialogue. Why not 0? Or if they say 7, say why not 4 or 5? And you'll hear them say, well, I do notice that if I eat better, and I really want to eat better, you get that dialogue started. Advantages to group care. I love it. How we do ours is we have 6-week classes. I have a storyboard up here if anyone wants to look after the class. It's kind of traveled all over the country. But it's kind of fun because you see you've got the patient in the center. And some of our people that help put this together are great scrapbookers, and I'm very grateful for their talents. But you've got your patient in the center with a team approach. Our 6-week classes, the first one is understanding nutrition and how to read food labels and how to eat healthier. The second week is how to monitor your blood sugar. It's amazing how people don't monitor their blood sugar. And we don't worry so much about highs, it's the lows that will kill you. And people often don't realize when they're having those funny feelings they should check their blood sugar. So the second week is monitoring. The third week is stress, because there's an enormous correlation between stress and your blood sugars. And then they actively come up with a plan. When you're feeling stressed, what are some things you do? You wouldn't believe the creative things people do to deal with stress. But then for them to have a plan, because even though you're doing that, you need to have that plan in place when that stress starts. What are you going to do when you start feeling those feelings? We work with a lot of patients with PTSD, and that stress level escalates within seconds. So they come up with their own plan of when they start feeling that stress escalating of what they're going to do. The fourth week is managing medications. Pharmacy comes and joins in. We go over medications. You wouldn't believe how many people didn't know that you shouldn't use your insulin when it's outdated. They aren't even sometimes drawing it upright. And so it's amazing to have these group classes. And the great thing about group classes is nobody feels dumb. Because if one person's doing it, somebody else is doing it. And they feel very empowered that they can learn correctly. And the fifth week is complications of diabetes, because we know diabetes hits about every organ in our body and affects every part of our being. And the sixth class, as I told you before, is a panel of topic experts that come and kind of do a review of the class. During the stress week, PT comes and does exercises with the patients. They get to do, even if they're in wheelchairs, they can do bands and arm lifts. During the medication, the pharmacist comes. Our provider champion there is at our meetings also. And one time during the 6-week section, she has an individual meeting with each of the patients. And they're just kind of off to the side. They're still in the same room. And then in 3 months, 6 months, and 9 months, they come in for shared medical appointments. And those are what I love, because this is one motivated group of people. They come in, they all get their A1Cs drawn, and then we talk very openly. John, your A1C was 11 today. Last time it was 10.9. What's going on? Or such and such, your A1C was 15.6. Today it's 11.2. What are you doing to succeed? And they are so proud. They share. And you don't even have to say anything as the provider, because they'll say, oh, I bet you were drinking Pepsi this week. I mean, they call each other on the carpet. It's a very camaraderie that is developed in these classes. We just finished our first 2 classes. Our first class, the A1Cs weren't real horrible, and they dropped all an average of 0.6. Our second class, all average drop was 1.7 on their A1C. And now they want a year reunion. They want to keep going forever. But the patient advantage is better access to care. You can see 10 patients in 90 minutes. They show up. We don't have no-shows. They show up for these appointments. It's a relaxed time with the provider, because it's not just that 15-minute appointment. They're there for you. Community of other patients with the same medical issue, it's almost like a support group. And they really learn from each other. What works for you? Well, I might try that. It might work for me. And open time for discussion. Like I said, we have become pretty grounded in the motivational interviewing and the facilitative style. We say very little. It's just more directing with open-ended questions and asking the right question. And then really opportunity for quality education related to specific medical needs. The provider advantage, I'll tell you what, satisfaction is incredible. We are getting more and more providers that are saying, hey, I want to start one of those group care shared medical appointments. You're having fun in there and it's working. And they're looking at each other's panels and the A1Cs and saying, I want to get on board with that. They have time to really listen to the patient and meet their needs and concerns. They really get to engage the patient and see the patient really learning self-managed care. They're not given the same old talk every 6 months when they see the patient of the still, well, you haven't lost any weight and your sugars are still like this. It's, you know, that dialogue isn't happening anymore. They only need to say it once. When you have 6 or 7 diabetic patients coming in one day and you have to say the same spiel, it's kind of nice to just say it once. Plus, they hear the same message. Plus, then you're using reflective skills and summarizing, so you're assuring that they heard the message. And it really enhances motivation and behavioral change. Advantage to the organization, definitely more patients can get in. Efficient utilization of space in exam rooms when you can see 10 patients at once. Improve patient outcomes. If that isn't an organizational advantage, I don't know what is. You know, the more we can keep our patients out of the hospital and the healthier we can keep people, the better society we have. It's predictable because you know when that diabetes your weight class is once a week. You know that that time is framed out in your schedule. And definitely efficiency. I can't tell you the satisfaction of our physician champion. She is so motivated and so incredible. We are now starting, I'll talk about some other vehicles we're using. We have 14 clinics throughout the state. We're now starting to set up classes by telehealth, where the facilitator will be at one location and the group of patients will be at the other. And so there's tons of venues you can use to do this. Group care can provide a vehicle for patient engagement, improved outcome, and I'll tell you what I've seen with patients taking on self-managed care has been phenomenal. Actually, an effective way to engage positive health behaviors. They're owning it themselves. They're becoming the captain of their own ship, and an opportunity for patients to learn from one another. Our appointments start at 2:30. They're hanging out in the waiting room at 2 visiting. They all show up early to visit. It really has become an incredible camaraderie. Group care can help improve health and well-being of the patients, definitely empower them because we're not directing them. We are just giving them the toolbox for them to do diabetes your way, because if it isn't their way, it's not going to happen and it's not going to be successful. And definitely create a network of support for these patients. And professional growth of healthcare care providers. My nurses fight over who's going to facilitate the class. I'll go. It's just an amazing satisfaction. One of the other things of the future of nursing is working people to their highest capacity. And being able to see nurses work at their highest level of capacity and teaching group environments and getting incredible satisfaction from their jobs is just amazing. And traditional versus group care, it's just kind of fun to look at the differences. Traditional is one-to-one. This is kind of the whole picture of what we have found in the differences. One-on-one exam room visit, care provided by the provider only, physical assessment, all's done by the provider or the nurse, and education's pretty fragmented and dependent on the provider. However, in group care, you have a space where you have 10, 15 patients at once. Care is really provided with a partnership with the provider and the patients and other team members. The people love that they have a team taking care of them. They think it's amazing that PT comes and teaches them exercise, or that the pharmacy comes and helps with questions of medication. They feel like almost a safety net has been created for them. Education runs through 6 sessions and trained and structured materials. As we're rolling this out, we actually have used this very same model for CHF. We have rolled it out to CHF. I think they are on their 5th class. We're seeing incredible outcomes. Hospital rehospitalizations have dropped by 17%. It's a model that really can be used for a large venue of chronic diseases. Traditional versus group. Traditional, there's few opportunities for the patients to interact with each other because you're just seeing one-on-one. Care is really provider-driven and focused on medical outcomes and recommended what you're told to do. Group care, however, is an opportunity for support building. It's focused on your outcomes and your own personal empowerment, and it's very patient-driven in a group setting. Patient services are often fragmented on traditional care. It's variable. Sometimes by the time physicians get done with your questions or your mid-levels, there's very little time for questions. Have you ever left a medical appointment where you didn't even get to ask a question? And they often say the same thing over and over. It gets kind of dull and mundane, and you only see maybe 3, 4 patients an hour. Group care, one-stop shopping. They can get their feet looked at, their blood pressures are done, their labs are done. They're given education at the same time. They have a time with the provider alone where they actually get a medical appointment. Only takes about 5 minutes. They spend 5 minutes with that patient during the group care, talking about where they are with their